First of all, I wanted to thank you all for coming. Many of you, most of you don't live here, so welcome to California. I hope you can stay tonight and enjoy it a little bit. Thank you for your time. We set this up at the end because we wondered if in having a panel of WIC people and then a panel of vendor people, it left sort of no opportunities for there to be the crosstalk. And I think a nice theme that emerged from both of your panels is how much you already talk to each other. And so I'll speak for myself, that was rather a relief, and I think probably for other committees too, to know that there is already conversations happening. So what I wanted to ask you now, as you're together, is are there areas for more synergy? Are there trouble areas that you want to share about? Because I do think that in the successful nationwide implementation of the new WIC food packages, whatever they may be, the relationships between your communities are critical. So are there, we're going to leave like 3 minutes for each of these. Are there critical things about the interrelationships that you feel were left unsaid?
Just communication.
Yeah, I was going to say, I think Tammy touched on a presentation that we had, a joint presentation we had with manufacturers and WIC folks in September. I can't remember when that was, where we shared information. Actually, I would say they shared information that we heard about what it takes to make changes and the time period for that. So that it seemed to me that opened the door for some dialogue about how we could work together and anticipate those things in a different way and understand what's required from each of us to make that happen, come out the other end so that WIC participants can make use of that. So I think that's a really important key, that communication.
And I'm not sure, is this on now? Yeah. Thank you. One thing I was thinking about earlier, Janet, actually, as you were talking about, was the needs that the WIC community might have that manufacturers can look into and reformulate to keep that door open. We had somebody approach us at a conference asking about halal certification on our yogurts, and I think there's only one yogurt in the country, it's not a national brand, that currently has that certification, but it is something we're looking into because we know it's important in some communities. So that kind of dialogue, that it's something of interest that might not normally hit our radar, is a terrific thing. The second thing, UPC codes, in terms of a topic, I don't know if that's something that there's a lot of concern out there about, but it seems to be a question that we hear about. And so if there's something we can answer on that and how those darn things get assigned and changed and communicated through WIC state agencies, we can talk about that too.
Yes, I think we could do about 4 hours on UPC codes, right? Debbie?
Well, that was, I'll take those. That was just one, it's a very, may just be us, and it may be not a national issue at all, but since you mentioned it, I will raise it. When a new product comes out with a UPC that is a WIC allowable product, it's not common, but it's not rare by any means that a participant chooses that product and we don't have in our system yet, and so they're stuck in the line and it's denying the sale. And so if there was some method of communicating new products to the state so that we could add those codes before the participant shopped for them.
So would that have been for a category that has any brand? Or is it like a specific brand? Because,
well, and this may be too big for here, and we don't need to get into it, but just any product, any food that's a WIC allowable food by USDA standards could possibly be, allowed by the state. Does that make sense?
I've heard that this is a lot easier for national manufacturers than it is for perhaps regional or potentially even store brand. With UPCs, anytime we have a new product, we have a list of all the folks from every state that we deal with, and we send out an announcement early in advance of that. Making a change to a UPC, if a net weight does change, can be a challenge, or when there's been a discontinued item, we notify that as well. I'm going to speak on behalf of all manufacturers now. Simplifying the system on how we notify and what time we notify and what method we notify states would be very helpful. The national UPC database may help alleviate some of this, but not every state is going to use the national UPC database. But it is difficult.
Yes, it is. Thank you, all. Another topic that came up, Tammy, correct me if I didn't quote you appropriately here, but I think in your discussion of whole grain cereals and the increased availability of whole grain cereals on the market, I think you were encouraging WIC cereals to all be whole grain cereals. Did I?
No, you're correct.
Okay, so, and I wanted to give the WIC partners an opportunity to respond to that.
So in Texas, I pulled redemption data for the last 14 months, and 71% of all cereal redemptions were for non-whole grain cereals. And I think that's really an alarming statistic. The current requirement for half of cereals to be whole grain is applied at the state offering level, not at the participant level. So you can be on WIC and only purchase refined grain cereals. And when we look at satisfaction with cereal in our state, I don't think you can attribute any of the redemption concerns with the whole grain requirements, since clearly they're not redeeming them. So I would say from a Texas perspective, we would strongly encourage the committee to consider doing some level of requirement at the participant level for whole grain. However, using the lesson learned here, that 51% is probably the right cutoff, because we need a gradual increase. And to Tammy's very, very helpful explanation earlier, it needs to be gradual for them as well. I think too, in looking at what the dietary guidelines presentation said earlier, added sugars are different than inherent sugars in a product. And so if we're going to push whole grains in cereal, perhaps we need to look at sugar content differently in our whole grain cereal content, because we really need to look at acceptance and palatability for our population.
And I just, can you hear me now? I did ask, folks in our region, and from our perspective, we probably would say to maintain what we have now. But I also looked at redemption data and was pleased to see that 56% of the cereals purchased in our state anyway were whole grain, as compared to 44% that were not. And some of those non-whole grain options, and I think Tammy, you alluded to this too, are also gluten-free options as well. And so that should be something that, to consider in addition.
If I could make a point on that. So that's actually not what I was saying on gluten-free. Okay, back when the rule was done with the 51%, it turns out that oat and wheat-based cereals primarily meet the 51% whole grain, and corn and rice don't inherently meet it. And that was the challenge back in '09. And a lot of manufacturers, including ourselves, have incrementally added more and more whole grain. So actually today we do have corn-based cereals that meet the 51% whole grain. So all the 3 Kix varieties, for example, meet 51%, and they're all based with corn. Rice Chex, Corn Chex do not meet 51%, but they deliver 12 grams per whole grain. So I think my recommendation would be that we simplify things and just say 8 grams minimum. Forget the 51% thing, because it's complicated. It was based on the old FDAMA rule. Oat and wheat primarily already met it. But within that, there was some language in the final rule about gluten-free and whole grain, which we're trying to correct. So, for example, we have Rice Chex, Corn Chex, multigrain Cheerios, and Cheerios, 4, that 2 of which meet 51% whole grain. The other 2 deliver 12 grams of whole grain, all labeled gluten-free. So gluten and whole grain can happen in the same box. And maybe that's what you're saying.
Yes.
Okay.
Yes.
So thank you. I'm going to keep moving us, because that clock keeps moving forward. A big topic, and Kathleen Rasmussen brought this up, is this up to. We heard it from both of your panels, is can I buy something with the up to amount, and the concern that Kathy brought forth, and I think you all responded to as well, what then happens in the marketplace, and is there some slippage in what's actually allowed? If you allow up to 32 ounces of yogurt, does that 32-ounce container all of a sudden become a 30-ounce container? Because 5 times 6 is 30, and is there slippage in the other areas? So that's not my question, but my question is, I think we have synergy across all these groups that up to makes sense. Okay. Any comments to the...
Administratively, it does.
administratively. Anything to the contrary, I didn't see anything to the contrary. So minimum stocking requirements, that came up a bit. Were there any further comments about that from the WIC? I'd like to ask the WIC community because it came up during the vendor panel, and then I'll circle back to the vendor panel.
I think that our viewpoint, I stated it earlier, is for the average grocery store, those minimum stocking requirements are not going to be an issue. Just because to be a grocery store, you got to have them there anyway to meet your quote unquote regular population of shoppers. So I just don't see the minimum stocking requirements that big of an issue. I mean, we do fall short sometimes on baby formula, but that's just a store not paying attention to what they're doing. It's not really an issue with not having shelf space or stockroom space in the back or anything like that. It's just more of a store not performing their duties properly.
So in Texas, and I know we're not the only state who's done this, we defined a store type for a full-line grocery. And that includes much more expanded stock than what's on the WIC food package. And we aligned it with the 2010 dietary guidelines because that's what was out there at the time. So beyond increased type and quantity of fruits and vegetables, there's a specified amount for dark green. There's a specified amount for orange and red. There's a specified frozen or fresh fish and poultry. And if you do beef or pork, you can actually sub out additional poultry or fish. So we literally aligned it with the dietary guidelines, and we designed it in a way that it could still fit for a small store model. And I think that for a public health program, we know that the 2009 changes in the food package severely impacted the food access availability for our communities, and particularly in low-income communities. So as much as the committee has it within their charge to make recommendations on minimum stock, I think it's a huge impact if we make that decision, not only for our participants, but for our communities.
Yeah, and I'd just like to add, under federal regulations, different peer groups, different store types can have different minimum stocking requirements. And particularly with states with large, diverse areas, some rural, some urban, it makes a lot of sense to set your minimum stocking requirements based on the store business models that are in that particular peer group. It just doesn't seem to make sense to use a very low minimum stocking requirements statewide when many of the stores affected by it are going to be major chain markets and others.
And you all may probably be aware of this, but Robert Wood Johnson Healthy Eating Research published a recommendation for healthy retail minimum stock in small stores. And they also, USDA proposed rules for SNAP minimum stock requirements that are consistent with what we're talking about here. So I think that there's a national movement in that direction anyway.
Most of you lived through the 2009 food package change, and you seem to be doing just fine. So we think that the next changes should hopefully be well received. Anything else from that experience that you feel needs to be brought forth to this committee that was missed?
I'll just share one point from the dairy perspective that when the final rule went into effect, it for changing of the milk types and also needing more availability of possibly quart milks, we brought the concerns forward to USDA that we weren't sure that processors could change quickly enough for the May 2014 deadline. And so we were pleased to see an extension to October for making that change of the 2% milk. So I think understanding that when changes occur, that enough flexibility, whether it's changing in net weights or formulation or product size availability, is really important. And it was helpful that USDA was able to make that extension for milk and put that out to all the WIC directors.
There was one part of the final rule that I think added complexity for both manufacturers and for state WIC agencies, and that was the timing, the rollout for the implementation, because then they'd have to touch their food list again and again and again. And that was hard. It's also hard for national manufacturers because if there is an item that is preferred or needed by WIC that maybe isn't out there already generally consumed, it is harder for a national manufacturer to do it piecemeal here and there as states are implementing.
Thank you. I wanted to also bring up, I forgot to mention this with the up to piece, which is that many states, well, all states by 2020 will be on EBT or have a waiver. And by then, that means families with multiple family members on WIC will have one card with all their benefits loaded. So what might that mean for the up to concept? And is there then synergy around combining people? What has been your experience with this so far, and what advice do you have?
And I got the wrong one. We follow the national UPC category subcategory structure, and that's was established by USDA, and it allows when you aggregate, even though you issue and educate according to the specific category of person and their specific nutritional needs as required, but the benefits are aggregated on the card, on a family card. So for example, we put all of the whole grains into one, it's in one category. So you could, if you have 2 children and a pregnant woman, you might have 80 ounces of whole grains total. So it's aggregated, and when the woman goes to the store, family goes to the store, being able to have the flexibility to buy different sizes of, like, you know, even if 20-ounce bread was on sale, to buy 2 loaves or 4 loaves, or 16-ounce corn tortillas with a combination of 24-ounce bread and 20-ounce other product. But that capability to give flexibility at the grocery store, because obviously participants are buying foods for their families, and we encourage them to eat as a family. And I think that's maybe a better understanding of, because sometimes I think some of the requirements are looked more at from the way we've been in the check world, and not necessarily looking at what we could be or what we will be in the EBT world.
I have one last one, but let me open it first to our committee. What questions are you left?
Thank you so much for an excellent panel. And I'm not sure if this is the right term, where you have participant to vendor ratios. I don't know if that's something that people keep track of. And with the new SNAP guidelines, because that's something that we're interested in sort of in a separate life, is to think about how does that change maybe people's absolute access when you put those additional requirements. And I think yours was really interested in what you mentioned, Lindsay, from the standpoint of having the meat and the fish requirements that are not core to the WIC food package, but may be some indication about the type of vendor that's there. Have you found, or is anybody aware of any work that's been done to see if those restrictions within states actually change people's access or limit access because the vendors that can't meet those requirements, like small minority vendors, some of the Latino vendors, or some of the non-urban vendors where there's fewer vendors, that it actually causes less access than more access?
So in our state, we have 2,200 vendor outlets. SNAP has about 17,000. So our challenge is, one, making sure we don't create a barrier to access, but two, not becoming so large in who we authorize that we can't handle it. And that's a really delicate balance. We have participant access defined in policy as a radius of 10 miles. So if a vendor applied and didn't meet our minimum stock requirement, before we would deny the application, we would do a check that within a 10-mile radius there is another WIC authorized vendor. If there's not, we would have to still consider their application. So there are checks and balances there to make sure that we're not creating a barrier. We do from time to time get vendors who may get upset that they're about to be disqualified or denied, and we'll hear you're hurting access. The nice thing about EBT is that we can actually pull where that participant is shopping from. So we can say they got benefits here and they're shopping here, here, and here. And those might be even closer stores than where that store who said they're going to create a participant access issue if we pull them off is actually located. So it's a very valid question, but I think there are ways to think through where, if that is a legitimate problem, we can still allow a store to come on the program.
Yeah, we have a similar system, and your question about the ethnic stores, I think, is really important. We've been challenged around how to support the ethnic stores and also meet the rules, meet the access. And this is also specifically around some of the halal interests that people have. So it is very challenging. I am interested to see how the SNAP rules, the new SNAP rules around minimum requirements will overlay and what effect that will be. We're trying to look at a way that we could, California has a model of having different requirements for those smaller stores, and we're looking at that, but I don't know how that'll mesh with what's required now, and it is a challenge for those smaller ones.
I'll answer this quickly because I know we're running short, but in Massachusetts, we don't have a vendor to participant ratio. We did about 20 years ago, and we dropped it because we spent more time fighting stores to come on than actually doing what we probably should be doing, which is other work. And we just tightened up some of our selection criteria, and we haven't found that the number of vendors coming onto the program has increased. It's actually, since we implemented EWIC, it has come down, our small stores. But we kind of figure, there might be a store here, and you might walk down a block, and there's another small store. We let them fight each other out for business, and it actually works in a good way because they have to keep their stores in, fully stocked and in good shape because they won't have to get the business. We have found that the business has really dropped a lot in our corner stores, but they're competing amongst peers, and we don't. We just spent more time fighting a battle, so we stopped doing it, and it has worked for us, but we're not like, Texas. We're a much smaller state, but it does work for us, and it keeps our vendors happier.
I just want to say, for those of you who are listening like Mindy was when I was talking earlier, we have 780 stores. I don't know why I said 170, but... Yeah, I know.
Committee, any further questions? All right, shaking of head. Thank you all for coming this far. And since we invited you this far, there's the 15 minutes of fame concept, but we don't have that much time. So if you have a final thing that you didn't get to say, you've come this far, please, we'd like to give you one last opportunity to say it, maybe starting with Janet on the other side. If you have nothing and you've done it, then thank you.
Just thank you so much for the opportunity today.
I would like to say thank you too as well. I have a handout that I left with Shannon after it goes through all the proper whatevers that it has to be in your hands. It just basically lets you see how we rolled out the food package from all the hard work that was done before. We wrapped it in the campaign of more color, more flavor, more life, and that's our EBT card, and that's what we have on all our materials. And so just a hearty thank you to you. And also on the bottom of this handout, there's a mom's testimonial of what WIC means to her so that you get to see what really matters, the end result of what you're doing. So thank you.
I just want to say thank you also for being included and for the committee asking manufacturers and vendors because we're part of the chain too when it gets through. And as you guys proceed, if there are ways that we can be, not we General Mills, but we manufacturers or vendors can be of a partner or answer any questions, please feel free to reach out. And thank you.
I would say the same thing she did, but it'd be a repeat. So, but thank you very much for allowing us to show up here and to be a part of your committee. It was an honor to be here. Really great.
Thank you very much.
Thanks as well.
I just wanted to say that as you're doing your very important work, that we are all trying to visualize this family around the table with these foods that they're feeling satisfied about what they have in front of them, that they are confident that they're providing healthy foods for themselves and their children. And how do we walk that back? How do we assure that the experience at the grocery store has the things available for them, that they're feeling that they're accepted in that store? How do we assure at the clinic that they feel welcome and that they're understood in terms of their background? So that's the part that really matters, that trip from the clinic to the store to the house to the home. So that's really what's important, and that we have that culturally appropriate and sensitive to the needs of those families. Social worker.
So I want to say one thing that didn't come up in terms of recommendations to the committee, and that is looking at the way that EBT or EWIC is redeemed in farmers markets. Once you move to a card, it's very difficult to move to a paper process in the farmers market environment. It's currently a big restriction with USDA. And I think that our farmers markets are not grocery stores. And so for them to use those benefits, we need to provide some flexibility there. To the committee, I would just say a hearty thank you for including me in this process. It's been a pleasure to be here as the one who wasn't here in 2009. It was nice to still be considered to come and give some testimony here. And lastly, I'll just say that I'm not envious of the charge that you have to balance, and especially under the guise of cost containment, because I just think that that's next to impossible. But as you're deliberating, I hope that you will prioritize public health outcomes first, and I know that you will. So I thank you for that.
I want to thank you for the opportunity for being here. Dairy products are such a large, important part of the WIC food package, and so sharing some of our experiences and our data, and we will continue to do that. But I want to thank you not just on behalf of the dairy industry that I represent, but also the dairy farmers who make the milk. Together, we are submitting comments and impacting, hopefully, good information for you. So it's the whole dairy industry. Thank you.
Thank you all for your time. Have a nice evening.
We're not quite done yet. Not quite done. For better or worse, your chair has to read a concluding statement, so I hope I have the mic on. Mic is on. Okay. So this concludes our information gathering. Folks, may I have your attention, please? May I have your attention, please, for just a minute? This is what we do here, is we have a concluding statement from the chair. And I get no imagination on this one, I just read the statement. So there you go. So this includes our information gathering session for today. The committee, and I personally thank you all for coming. For all of our presenters today, you have exceeded our expectations in terms of giving us the information that we need to be helpful. You are welcome to join us for the public comment session that begins tomorrow morning at 8:30, I believe, in the same room. I have two final notes to mention regarding the study. The final data gathering session for this study is planned for June 29th in Washington, D.C. Information will be posted on the website shortly after this meeting. The June meeting will include both a workshop and another public comment session, so if you have others from your industry or your state who would like to comment, that's an open opportunity. Again, thank you all for coming. We wish you safe travels if you're not going to be with us tomorrow. This meeting is officially adjourned.